Mr. Speaker, I am, although you called me Mr., I'm actually a physician. And so in my other life, in fact, I saw patients yesterday at a public hospital in Louisiana, a safety net hospital where I've worked for the last 20 years. And so caring for the uninsured has been my life's work since completing my residency and returning home. And I've learned that if you don't pay attention to cost, that it doesn't matter how passionate you are for the uninsured, the fact is that you are unable to achieve your goals. There are three goals of health reform, and they are commonly said to be controlling cost, to provide access to high-quality care. And in the hospital where I work, a safety net hospital, they are committed, they are so passionate for the underserved folks who are med techs, physical therapists, ward clerks, physicians, nurses. But the problem is, if there is a budget shortfall, then inevitably services suffer. So it doesn't matter how passionate we are in our service. The fact is that if there is insufficient resources in the state at the end of the budget year, then services suffer. It may be that nursing staffing is decreased and hospital beds are closed so that if somebody comes to the emergency room, they have to wait in the emergency room before they're admitted. Inevitably, when that happens, the hospital goes on what is called divert, whereas instead of coming to our hospital, they will be diverted to another hospital. And that's because if you don't control cost, inevitably access and quality suffer. Now, I was struck that President Obama agrees with this. President Obama continually speaks about the need to bend the cost curve down, the need to control cost, because if we do not control cost, then our economy suffers and the ability to provide care suffers. Now, it's one thing to say that we're going to control cost, but in order to expand access to quality care, but you've got to have a plan on how to get there. There's a company called McKinsey & Company, and on their website they have an article, you can download it, a great article called The Three Imperatives of Healthcare Reform. Without achieving these three imperatives, then we cannot control cost in a way which expands access to quality care. Now, the three imperatives that they list are decreasing administrative cost, how much money we put into bureaucracy as opposed to patient care, incentivizing healthy lifestyle. Put differently, if people insist on smoking and drinking, and if they're too heavy, it doesn't matter how much we throw at health care, we'll never control cost because we're always trying to catch up with disease as opposed to preventing it. And lastly, cost transparency. Someone going in for knee surgery needs to know how much her bill will be before she goes in, as opposed to learning about it 2 months later when she gets the bill. It's important for us, therefore, to achieve our goals of cost containment, to provide access to quality care, to work through these three imperatives. Now, the bill we just passed, H.R. 3962, on the face of it does not achieve these three imperatives. As an example, if you're going to decrease administrative cost, you don't achieve a decrease in administrative cost by creating 111 new bureaucracies, boards, and commissions. I mean, it's just laughable to think that we're going to put that much more money into administration, build that many more buildings, hire that many more people, and at the same time say we're decreasing administrative cost. There's very little in the bill that incentivizes healthy lifestyle. You can argue that those provisions in the bill that address this weaken the current provisions that we're finding effective. And lastly, there's not a whole lot that provides cost transparency. Indeed, one of the things that has been used to encourage cost transparency is the use of health savings accounts, and now health savings accounts are being taxed as they've not been before. So it's not surprising if these three imperatives are not addressed that we can say that cost is not being controlled. Now, by the way, it's not just me who says that cost is not being controlled. We also have here a quote from the Washington Post. We have a quote from the Washington Times. In the Post article, it says, it does not do, speaking of this bill, it does not do enough to control cost, and it's not funded in a sustainable way. The headline from the New York Times, I think this was November the 7th, Democrats, or this may have been the 10th, Democrats raise alarms over health bill cost. Democrats are raising alarms over the cost of this health bill. That's so important. Because if you can look in any healthcare system, if you don't effectively control cost, eventually access to quality care suffers. I've been living this for 20 years. In my life, we know this to be true. And so here we see from a couple different sources, the Post and the Times, that this bill does not do enough to control cost. Now, turn